Hi, my name is Helen Henry Anunike, and I'll be presenting on the topic which is shown on my screen: psychological stress and coping strategies. I'll be presenting on a 10-minute slide. The next on my table is a table of content: the source of psychological stresses, the impact of stress on both mental and physical health, and also the varieties of coping mechanism. An evaluation of the effectiveness of these problems is going to be highlighted, comparing the effectiveness and the coping strategy and barriers of effect that is affecting the coping, and also the conclusion. And my reference is going to be well detailed. Thank you. Mental health. From my introduction, mental health is an integral part of our general well-being. It is a brain body responder determine of how an individual behave, things, act, and also interact with others surrounding in the society. In our daily life, individuals are faced with different tasks, such as performing well in education, lack of money, financial resources, family obligation, and others. All this may lead to stress, and when the individual is overwhelmed, stress will come in. Then the stress does not only happen in time. Stress does not always is not always bad in all time. Low level of stress could be utilized for motivational purpose of making the persons perform better, which when you meet up with all your deadline on time. But when the stress become too much, it could have an effect on the health of a person. So the next one in my in my slide is psychological stress. Psychological stress is one of the happens when one feels challenged in coping with what is being placed on before them, and when you think or should or things should happen or could happen compared to what things that are capable of dealing with. Stress can be classified into a different section: acute stress, habitual stress, and also acute stress could be defined as a long-term stress which people experience on day-to-day basis, for instance, through financial problems or illness. And acute is also could have happen in a short-term source, which may be thought of an examinations of interview of an interview for a position. Okay, those are when we have experienced this. This could be considered as a reaction to expectation, which is a serious mental problem when it becomes an habit. Okay, so the next one in my slide is it's a major source of psychological stress. There are different types of major source of psychological stress, which is academic and work related. Academic and work related could be is a common source of stress in our society. You have to deal with a work related issue, with deadline issue, competitions, which is a fear of failure in your workspace. Causes may result in tensions all along. For example, concerning students and worrying regarding their examinations and results. Employees dealing with long-term hours and insecurity and at work. So it could also have unchecked, if not unchecked. This stress could cause a potential hinder and concentration, motivation, even a performance. This performances itself. So it could also cause a long-term effect. So financial and economic stress could also cause sleep disorder, irritability, hopelessness, and also increase the risks of depression, anxiety. And then financial relation and social stress could also cause a whole long time stress, whether it's a relationship, feeling of love. It could also being of isolation from society aspect. It could also cause a whole lot of impact on stress. Typical social stress are breakup, divorce, family expectation, bullying, societal rejection, lack of social support, and then feelings of misunderstood and alone makes it harder for us to deal with this kind of stress. And then life changes trauma. Positive life events are source of stress that could adjust different residents or workplace or even entering adult negativity. This event can cause death, it can cause illness, it can also cause injury, and also the stress could cause painful consequences like physical trauma, and the fear and insecurity. It could cause loss of emotional stress, in order difficulties in trust, and symptoms of post trauma and stress could also be affected. Another one on my list could also be emotional effects, emotional and psychological effects, and also physical effects, which can cause high blood pressure, digestive disorder, weakness, and the symptoms, weakness in fatigue and sleeping disturbances. Another one is a behavioral and social effect. This kind of effect could cause people with could be distressing to people. Some people become distant from other, while the other become irritable. Stress behavior can include skipping responsibilities, eating too much, lost appetite, greater use of alcohol, less productivity. It could also be social isolation. So when this behavior occur, it could deteriorate relationship and well-being of when being left unsolved. Okay, so the next one on my page is definition of a coping strategy. Coping strategy are the thoughts and action which are employed to reduce stress. These strategies can be divided into two: problem focused coping, which is addressing by the source of it itself; emotional focused coping, which is emotional trigger during the stress. In both cases, is significant and method choices may change depending on the scenario. Okay, so Okay, so the next one on my slide is the problem coping strategies. These strategies could be managed in a situation that cause stress itself. Example of this include the management of time, setting realistic goals, solving a conflict, and making practical changes to reduce the pressure. The next ones on my slide is social support and coping strategy. It is very powerful to cope with stress. Taking friends and family members, teacher, counselors can provide comfort, advice, and reassurance. Benefits of this are feeling understood and less alone, gaining new perspective, increasing confidence and effectiveness. This could also be a strong social support to cope better with, and also healthy life strategy. Healthy lifestyle strategy is a living lifestyle which through which the stress could be managed. This habit could be managed through exercise, physical activity, reducing consumptions and rest and breaks. Okay, so the next one on my list is professional help. You could also seek a professional help by a therapist or a counselor. Some of these approaches could be CBT, which is recognized in a recognitive behavioral therapist. Mindfulness, you could practice the mindfulness and also effectiveness. And then the next one could be comparing the effectiveness of the strategy. Each of these strategy is effective problem which is causing coping occur when changes can actually be offered. Okay, so the next is emotional focus. It also building enhancements of emotional resilient lifestyle changes promote enhanced well-being and also avoiding stress. It intense and chronic when test of stress. Professional helps to also be called, which is the next one on my list. The next one on my list is comparing the barriers and effectiveness of this. While coping strategy may be helpful, some experience barriers in as forms of lack of attention to stress, cultural belief, and discourage seeking help, poor access of mental services, fear of stigmatization, judgment, lack of time to motivate. This barrier could also exhibit an individual to be use coping mechanism method to manage their stress. In conclusion, the psychological life case of has become severe and strong, that a particular kind of stress has been affected and the health. Its source include the academic pressure, financial, interpersonal issues, and also may lead to issues like depressions when one become unable to handle this kind of stress. So through the stress knowledge and learning strategies of coping mechanism, individuals are also able to build up strong mental cases The next one in my slide is my reference, which is being also highlighted. Thank you and bye for now.